First signs of schizophrenia. Introduction. Schizophrenia is a complex and chronic mental health disorder that profoundly affects how a person thinks, feels, and behaves. Often misunderstood and stigmatized, this illness presents with a variety of symptoms that typically manifest in late adolescence or early adulthood. Identifying the first signs of schizophrenia is crucial for early intervention and treatment, which can significantly improve outcomes for individuals affected by the disorder. Early symptoms of schizophrenia. 1. Subtle changes in behavior and thinking. A social withdrawal. One of the earliest signs of schizophrenia is social withdrawal. Individuals may begin to isolate themselves, losing interest in social activities and distancing themselves from friends and family. This withdrawal can stem from feelings of being overwhelmed by social interactions or a growing sense of mistrust towards others. Decreased motivation. A notable decline in motivation, also known as avolition, is common in the early stages of schizophrenia. Individuals may struggle to initiate and sustain activities, leading to neglect of personal hygiene, academic or occupational responsibilities, and hobbies. C. Cognitive impairments. Cognitive impairments often precede the more obvious symptoms of schizophrenia. These can include problems with attention, memory, and executive functioning. People may find it difficult to concentrate, follow conversations, or remember important information. 2. Emotional changes. A blunted affect, or a reduction in the expression of emotions, is another early sign. Individuals may appear emotionally flat, showing little response to situations that would typically elicit an emotional reaction. B. Anhedonia. Anhedonia, the inability to experience pleasure, is also common. Activities and experiences that once brought joy may no longer hold the same appeal, leading to a marked decrease in overall life satisfaction. 3. Thought disorders. A disorganized thinking. Disorganized thinking is a hallmark of schizophrenia. In its early stages, this may manifest as difficulty organizing thoughts or speaking coherently. Individuals might jump from one topic to another, making their speech hard to follow. B. Delusions. Delusions, or false beliefs that are resistant to reason or contrary to reality, can also emerge early. Common delusions include paranoid beliefs, e.g., thinking one is being watched or persecuted, or grandiose delusions, e.g., believing one has special powers or significance. 4. Perceptual disturbances. Hallucinations. Hallucinations, particularly auditory hallucinations, often mark the onset of schizophrenia. Individuals might hear voices that others do not hear, which can be distressing and confusing. These voices can be critical, commanding, or conversational in nature. B. Sensory sensitivity. Increased sensitivity to sensory stimuli is another early sign. Individuals might become overly sensitive to lights, sounds, or textures, finding these experiences uncomfortable or overwhelming. 5. Behavioral changes. Odd or unusual behavior. Odd or unusual behaviors may become apparent. These can include strange postures, inappropriate or bizarre actions, or a noticeable change in routine or interests. B. Agitation or irritability. Increased agitation or irritability can also be an early sign. Individuals might become easily frustrated or angered, often without clear provocation. Biological factors. 1. Genetic predisposition. A family history. A significant risk factor for developing schizophrenia is having a family history of the disorder. Studies have shown that individuals with a first-degree relative, such as a parent or sibling, with schizophrenia have a higher likelihood of developing the condition. B. Genetic variations. Certain genetic variations are associated with an increased risk of schizophrenia. Research continues to uncover specific genes and their roles in the development of the disorder, highlighting the complex interplay of genetic factors. 2. Neurochemical imbalances. A dopamine hypothesis. The dopamine hypothesis suggests that an imbalance in dopamine levels in the brain contributes to the symptoms of schizophrenia. Overactivity of dopamine in certain brain pathways is thought to be linked to psychotic symptoms like hallucinations and delusions. B. Other neurotransmitters. Other neurotransmitters, including glutamate and serotonin, are also implicated in schizophrenia. Imbalances in these chemicals may contribute to cognitive and emotional symptoms. 3. Brain structure and function. Structural abnormalities. Brain imaging studies have revealed structural abnormalities in individuals with schizophrenia. These can include enlarged ventricles, reduced gray matter volume, and changes in the structure of the hippocampus and other brain regions involved in cognition and emotion. B. Functional abnormalities. Functional abnormalities, such as altered brain activity in certain regions, have also been observed. These changes can affect how the brain processes information, leading to the cognitive and perceptual disturbances seen in schizophrenia. Psychological factors. 1. Early childhood experiences. Trauma and stress. Early childhood trauma and significant stress can increase the risk of developing schizophrenia. Adverse experiences, such as abuse or neglect, can have lasting impacts on brain development and function. B. Attachment issues. Problems with early attachment, such as insecure or disorganized attachment styles, may also contribute to the development of schizophrenia. Difficulties in forming healthy relationships can affect emotional regulation and social functioning. 2. Cognitive vulnerabilities. Attentional deficits. Attentional deficits, such as difficulties in sustaining attention or filtering out irrelevant information, are common in individuals with schizophrenia. These cognitive vulnerabilities can precede the onset of more severe symptoms. B. Executive dysfunction. Executive dysfunction, including problems with planning, decision-making, and problem-solving, can also be an early indicator of schizophrenia. These difficulties can impair an individual's ability to manage daily tasks and responsibilities. Social factors. 1. Environmental stressors. Urban living. Living in urban environments has been associated with a higher risk of developing schizophrenia. Factors such as social stress, exposure to pollutants, and lower social cohesion may contribute to this increased risk. B. Socioeconomic status. Low socioeconomic status is another risk factor. Financial stress, limited access to resources, and social disadvantages can exacerbate the risk of developing schizophrenia and affect the course of the illness. 2. Social relationships. Social isolation and a lack of supportive relationships can contribute to the onset of schizophrenia. Positive social interactions and support networks are crucial for mental health and resilience. B. Family dynamics, including communication patterns and levels of expressed emotion, can also play a role. High levels of criticism, hostility, or over-involvement within the family can increase stress and exacerbate symptoms. Impact on individuals in families. 1. Personal impact. Daily functioning. The early signs of schizophrenia can significantly impair daily functioning. Difficulties in concentrating, managing emotions, and interacting with others can affect educational, occupational, and social outcomes. Being mental health. The distress associated with early symptoms, such as hallucinations or delusions, can contribute to anxiety, depression, and a sense of hopelessness. The fear of stigma and misunderstanding can also exacerbate these feelings. 2. Impact on families. Emotional burden. Families of individuals with schizophrenia often experience significant emotional burdens. Concerns about their loved one's well-being, the uncertainty of the illness course, and the demands of caregiving can lead to stress and burnout. B. Social and financial strain. The social and financial strain on families can be considerable. Supporting a family member with schizophrenia may require substantial time, resources, and adjustments to family dynamics and routines. Early intervention and treatment. 1. Importance of early intervention. Of improved outcomes. Early intervention is crucial for improving outcomes in schizophrenia. Prompt recognition and treatment of early symptoms can prevent the progression of the illness and reduce the severity of future episodes. B. Reducing duration of untreated psychosis. Reducing the duration of untreated psychosis, DUP, is associated with better long-term outcomes. The longer psychotic symptoms go untreated, the more challenging they can be to manage and the greater the impact on the individual's life. 2. Treatment approaches. Pharmacological treatments. Antipsychotic medications are the cornerstone of treatment for schizophrenia. These medications can help manage symptoms such as hallucinations, delusions, and disorganized thinking. Early and appropriate use of medication can significantly improve outcomes. B. Psychosocial interventions. Psychosocial interventions, including cognitive behavioral therapy, CBT, social skills training, and family therapy, are also essential components of treatment. These approaches can help individuals develop coping strategies, improve social functioning, and enhance family support. C. Supportive services. Supportive services, such as case management, vocational rehabilitation, and peer support, can help individuals with schizophrenia navigate daily challenges and achieve greater independence and quality of life. 3. Prevention strategies. Of identifying at-risk individuals. Identifying individuals at high risk for schizophrenia, such as those with a family history or early signs of the disorder, can facilitate early intervention. Programs that focus on monitoring and supporting at-risk individuals can help prevent the onset or reduce the severity of symptoms. B. Reducing environmental stressors. Reducing environmental stressors, such as addressing socioeconomic disparities and promoting supportive social networks, can also help mitigate the risk of developing schizophrenia. Creating environments that support mental health and well-being is crucial. Conclusion. Schizophrenia is a multifaceted disorder with a range of early signs that can affect individuals' thoughts, emotions, and behaviors. Understanding these early signs and the factors that contribute to the development of schizophrenia is essential for early intervention and effective treatment. By recognizing and addressing the first signs of schizophrenia, healthcare providers, families, and communities can work together to support individuals and improve their quality of life. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.